So how do drugs influence the autonomic nervous system? They can mimic or block the effects of the two primary neurotransmitters, such as acetylcholine and norepinephrine, epinephrine. Drugs that mimic neurotransmitters are referred to as receptor agonists, or you can just say agonist. These drugs activate the receptors. Drugs that block neurotransmitters are referred to as receptor antagonists, or just antagonists. These drugs are going to block endogenous neurotransmitters from activating the receptors. So let's look at some examples of muscarinic antagonists. Atropine blocks acetylcholine from stimulating muscarinic receptors. You want to star that. Know that atropine is going to block acetylcholine from activating its muscarinic receptors. This results in a decrease in GI motility, secretions. It's going to cause pupil dilation, because remember, the parasympathetic is what's going to cause vasoconstriction. When you take atropine, that's going to cause pupil dilation. And it's also going to cause tachycardia, because remember, the acetylcholine causes a decrease in heart rate. It's used clinically to dilate the pupils during an eye exam, although they have other drugs that do this now. This was used long ago for dilation of the pupils during eye exams, but what they found is that the atropine was pretty strong, and it would cause dilation for up to a day or two. So they have other drugs that will cause dilation, but they only last for about 4 or 5 hours. They're also used to treat peptic ulcers. Historically, it's been used by women during the Middle Ages to dilate their pupil and enhance their beauty. Atropine is derived from the nightshade plant called Atropae belladonna. Women in the Middle Ages, it was thought that if you had dilated pupils, it was an attractive characteristic. So they would take the juice from this belladonna plant and they would drop it into their eyes, and they'd have dilated pupils, and that was one of the things that made them, or at least they thought they made them more beautiful. Adrenergic neurons. They're going to release norepinephrine, or noradrenaline, and the adrenal glands both release epinephrine and norepinephrine. Most sympathetic postganglionic neurons are adrenergic neurons. Epinephrine and norepinephrine affect two categories of membrane receptors. They're designated as alpha 1 and alpha 2, and beta 1 and beta 2. The action, excitatory, they're going to increase contraction of heart muscle and constrict most blood vessels. They also have an inhibitory effect, where they have relaxation of the bronchioles. So it just depends on the receptor it binds to and what the action is of that receptor. And so there are multiple tables you can look at for the selected adrenergic effects in different organs. So for example, if you're looking at the eye, sympathetic nervous system is going to cause the pupils to dilate. And they're going to affect the alpha 1 receptors that are located in those smooth muscles of the pupils. In the heart, it increases heart rate and contractile strength. It primarily affects the beta 1 receptors. In the skin and visceral organs, the arterioles constrict due to smooth muscle contraction. It's going to affect primarily alpha 1 receptors. And so there are multiple tables in through here that you can take a look at. Bronchioles are going to dilate due to smooth muscle relaxation, and they're going to be affecting beta 2 receptors. And that's actually one you need to memorize. But the rest of these, besides what's on the heart, what's on the lungs, and the others that I'm going to point out during the lectures, you don't have to memorize all these. Beta blockers, though, you need to know this. So you heard of people who have high blood pressure. One of the ways that they can be treated is by taking a beta blocker. And what beta blockers are going to do is they're going to decrease heart rate and force of contraction. Recall that activation of beta 1 receptors increases heart rate and strength of contraction. So you want to star that. If you take a beta blocker, such as altenerol, that's a beta 1 antagonist, which is going to block that receptor, and it's going to reduce heart rate, and it's going to reduce forced contraction or myocardial work. That's going to help to treat hypertension. Now, beta agonists, they activate beta receptors. So activation of beta 2 receptors causes relaxation of bronchial smooth muscle cells. Epinephrine is a beta 1, beta 2 agonist and causes bronchodilation, relaxing the smooth muscles of the bronchioles. This drug can be used to treat asthma. However, it also increases heart rate and force of contraction. So epinephrine is used in an emergency situation where somebody has an asthmatic attack or somebody has an allergic reaction where their bronchioles are beginning to constrict. They can take epinephrine, and that's going to relax those bronchioles to allow more air to get into the alveoli. But at the same time, it's going to increase heart rate, and it's going to increase force of contraction, and it's going to cause smooth muscles of the arterioles to vasoconstrict, and that's going to increase blood pressure. Drugs such as albuterol is primarily a beta 2 agonist that's going to cause bronchodilation, and it's used to treat asthma symptoms. Why do you use this over epinephrine? Well, if it primarily affects beta 2 receptors, it's not going to have as great of an effect on the heart. It's not going to increase heart rate as much as epinephrine. Now, that is one of the side effects of albuterol, is an increase in heart rate, but it's a minor effect compared to epinephrine. Alpha-1 agonists. Phenylephrine is an alpha-1 receptor agonist, and it's a common ingredient in cold and sinus medications. Using phenylephrine reduces mucus production in the nose by constricting the blood vessels in the nasal mucosa, thus relieving the nasal drip that you get. Alpha-1 is found on most arterioles of blood vessels, and so when you activate epinephrine, norepinephrine, and it binds to alpha-1, it's going to cause blood vessels to vasoconstrict. So you take drugs such as phenylephrine, which is alpha-1 receptor agonist, it causes vasoconstriction, so you don't get as much blood flow to the nasal mucosa, and it reduces those symptoms. When you look at the effects of nicotine, well, nicotine is a stimulant drug that acts as an agonist at nicotinic acetylcholine receptors on autonomic ganglia, the adrenomedulla, the neuromuscular junction. In the brain, nicotine exerts a reward effect in the limbic system and is a highly addictive substance. So in the brain, nicotine is going to bind to nicotinic acetylcholine receptors on dopaminergic neurons in the limbic system. Those dopaminergic neurons, when they're stimulated by nicotine, are going to release dopamine. It's because they have nicotinic receptors. And so when acetylcholine stimulates those dopaminergic neurons to release dopamine naturally, well, then you're going to get that pleasurable effects of dopamine and all the things that it does with reward and pleasure and all the powerful things dopamine does. Nicotine stimulates those dopaminergic neurons to release dopamine, and that's responsible for the pleasurable addictive properties of nicotine. Nicotine also stimulates the postganglionic neurons in both the sympathetic and parasympathetic divisions. It can have a wide variety of effects, because remember, the cell bodies of postganglionic neurons and parasympathetic and sympathetic both have nicotinic acetylcholine receptors. However, where you see one of the biggest effects is that nicotine binds to nicotinic receptors on the chromaffin cells of the adrenomedulla. It stimulates the chromaffin cells to release epinephrine and norepinephrine into the bloodstream, which causes vasoconstriction, increased heart rate, increased blood pressure, and increased blood glucose levels. So if you look at norepinephrine and epinephrine, they're really close together. In fact, the only difference between these two is that epinephrine has an extra CH3 group here attached to the amino group. Here's acetylcholine, here's muscarine and nicotine, the structure of those chemicals.